Hi, Patricia here from Rapid NCLEX. In today's video, we'll be talking about peripheral venous disease or venous insufficiency. Venous insufficiency results from prolonged venous hypertension, which stretches the veins and damages the valves. In this condition, veins in the lower extremity cannot transport blood back to the heart, meaning that blood is having a hard time getting to the heart due to the damage to the valves in the veins. Some of the risk factors to peripheral venous disease or venous insufficiency include obesity, immobility, pregnancy, and a history of deep vein thrombosis. So for the signs and symptoms, patients with venous insufficiency will have edema, especially edema of the affected leg, brown skin discoloration over the lower extremity, that is also known as stasis dermatitis, heavy draining wounds in the ankles. So for the nursing management, our main aim is to promote blood return from the heart. Okay, so nursing management, we are going to elevate the legs to promote blood return to the heart. Give compression stockings, and then we are also going to apply the compression stockings in the morning before the patient gets out of bed. This is highly tested in the NCLEX exam. Okay, for any patient who is supposed to put on a compression stockings, they should put it on before getting out of bed in the morning. We are also going to monitor for complications associated with venous insufficiency, such as cellulitis. Then we'll also educate the patient to avoid sitting or standing for a long period. We'll educate the patient on the importance of wearing the compression stockings. We'll also educate the patient to avoid crossing the legs, and also they should avoid wearing restrictive clothing. Let's emphasize on the point that the patient is supposed to wear the stockings early in the morning before getting out of bed. Also, let's take note that in venous insufficiency, their wound care is very key. So we are going to provide wound care to the wound as prescribed. We'll assess the client's ability to care for the wound and initiate home care resources as necessary. Take note that in some situations, we are going to prescribe an Unna boot. So if an Unna boot is prescribed for this patient, it means that the patient will have to come to the hospital weekly for the primary health care provider to dress the wound. And also, let's educate the patient that at any time, if they are feeling severe pain or tightness of the boot, they should bring it back for the primary health care provider to loosen it for them. All right, thank you, and see you in our next video.